Welcome to Kids Matter. I'm Dr. Elisa Minkin. As a pediatrician, mom, and grandma, I understand how challenging it can be to help our kids grow into their best selves. We are so much more powerful together. Here, I will be sharing the knowledge and wisdom of a wide range of people who understand and care deeply about children. I'm hoping for your input as well, because kids really do matter. They are our future. Welcome. Today we're discussing how to navigate divorce and other family stresses with Dr. Staci Weiner. Hi, thank you for coming here today.
Absolutely. Thanks for having me.
I'm super excited because not only are you a licensed clinical psychologist with over 20 years of experience and the founder of Apple Psychological, but you're also a forensic psychologist with Robson Forensic for the past 6 years. First, please just tell me, what is a forensic psychologist?
Yeah. So forensic psychology is a specialty within psychology, and it applies to the psychological science and also the clinical expertise for legal questions and court-related context. So it's the intersection between psychology and the law. So it helps courts and attorneys and legal systems to understand psychological concepts such as trauma or other related psychological concepts and how the brain works.
That just gives you an incredible background, though, into our topic of the day, which is helping our kids cope better with lots of stress. We're going to focus more on divorce because I heard you speak on a podcast specifically about helping neurodivergent kids with divorce. And I want to get to a little bit of that too, because that was super, super unique, I thought. But then a little more of your bio before we let you talk more. You hold a master's degree in school psychology, as well as a doctoral degree in school clinical psychology from Pace University. You're licensed to practice in New York and Florida, and you participate in PsyPact, P-S-Y-P-A-C-T, and there's going to be a link in the show notes for people to figure out whether their state participates in PsyPact, and for that you do telepsychology, correct?
Right. Yes.
Dr. Weiner, welcome to the show.
Thank you. Thanks for having me.
Super excited to be here. And again, your background is going to really give you so much more nuance to these topics. So I want to start with saying, what are family stressors? I use the term family stressors as opposed to the stressor from the child themselves. What is that?
We go through as a people like family stressors all the time, some more than others, but some examples of family stressors are like an illness or a loss in the family, chronic conflict between caregivers, if there is addiction or substance abuse by a family member, if there is a financial strain or housing instability or food instability. And of course, as you discussed, divorce or separation, if there's parental mental illness or a mental illness of a family member. So these are common stressors that families go through.
Thank you for explaining that. And I want to acknowledge that we are living in really challenging times. Without going into specifics, there's just so much stress that adults are experiencing, and it filters down to the kids. And so I think this is a really important topic. So I want to focus specifically on divorce to give us a lens, and maybe the conflict that happens before the divorce as well. So I want to start with, how do you think that divorce and family conflict affects kids? How does it affect them?
So with kids, right? So first of all, just to go back to the stressors for a second, right? Very often we're not feeling one stressor, right? There's multiple stressors going on in our lives, right? And as we know with kids, they are focused on their own world usually, right? And they have their own stressors of school, friends, conflict, whatever. They have their whole world to deal with, right? So when there's a divorce in the family, their routines and the way that they know life is disrupted, right? It has to be reorganized. Very often their schedule changes drastically. So maybe they have to go from one house to another house. They have to organize their things differently. Their environment changes. This adds another level of stress in their life, in addition to all of the other things that they're experiencing as a normal child in their developmental level.
I want to take a step back, though, and we don't even have to specifically focus on divorce at this point, but to talk about how these stressors impact kids. Because what you just said that's really important is kids need predictability and they
Yeah.
can lose that
Yeah.
with divorce. But let's just go back a little bit to the stressors because I want to set the ground for what context divorce happens in.
Yeah. So, very often kids feel that they're in the middle of the conflict. So they might feel loyalty to one parent or another. They might feel very conflicted about what they can say and how much they can express. And that's very difficult for kids because maybe prior to the divorce or separation, they felt comfortable just saying whatever they wanted to say. And then now they're feeling out their environment and are unsure. And very often it provides just an environment that's uncertain or different, something that needs to get adjusted to. It's depending on the level of conflict in the divorce. Some divorces can be amicable, some are not. So, depending on the level of conflict and also the amount of education that the parents have and how open they are to seeking psychological help, the kids could face significant stress.
So, what are some things that you've seen that have made it better and made it worse? And I want to focus also on the made it worse,
Yeah.
even
Yeah.
though that's negative. Sorry.
So, yeah. So I think making it worse would be when parents put kids in the middle of the conflict. So sometimes parents will have kids act as a messenger, tell your mom that, and that's, they might think, what's the big deal? Or they're going to see their mom later. They could just tell her. But that's really difficult for kids when they're put in the middle of the conflict. So that I would say makes it worse. Also, when parents speak poorly about the other parent, that is really difficult for kids. And it becomes very tricky because sometimes the parent is not doing the right thing, or the parent who wants to say something bad about the other parent has a valid reason. But we have to remember that the parent is still the parent. So the parent that, let's say the mother wants to say something negative about the father is still the father of the child. And we have to remember that. And there is certainly a lot of conflicting feelings in the children when they hear negative things about the other parent. Because do I defend that parent? Do I not say how I feel? It's very difficult for them to know how to navigate those emotions.
It's true. And I feel like I say this in every podcast that I always say, put your oxygen mask on first. I think this is a really challenging thing for the parents going through this. And I feel like when we
Yes.
talk about parenting, we don't talk about how the parents are functioning. So we have to
Yes.
take a step
Yes.
back and
I'm
do
very
that.
big on that.
Talk more, please.
Absolutely. Absolutely. No, I'm very big on helping parents and have a lot of empathy for parents. And I'm a parent myself. And it's the most difficult job in the world, right? And even the best intentions, most parents that I have worked with, I would say 99% probably have good intentions. They want to help their children. They want the best for their children, right? But our emotions get in the way of that. And divorce is very complicated very often. And there's a lot of hurt feelings, anger, frustration, feeling like it's not fair or one person got the better deal than the other one or whatever it is. And there's just a lot of conflicting feelings there. And that makes it very challenging for all of us to act in the most proper way that we know is best. As you said, I think that focusing on parents is so important and validating the challenge and that they might want to say horrible things about their spouse or use their kid because they don't want to make a phone call or deal with the other person. So it's just easy. I'll just ask the kid to get the answer for me, right? It's so easy to really fall into those behaviors and those habits. I think it's twofold. It's one, educating, right, parents on what can happen and why this is a stressor. And two, helping them to cope with their emotions so that they're able to get to a healthy and stable place so they could provide that for their
I
kids.
love that you said that because that was really what I was getting at. There's two different pieces to this. One is for the parent to be able to be coping well enough to help the child. That whole
Yeah.
concept of co-regulation, if you're not regulated, you can't help your kid. And it's
Yeah.
normal for you to not be regulated. I don't think anybody's so regulated
Yes.
anymore.
Yes. Exactly. Yes.
Get your own
It's
help,
expected.
right? Get your own help.
Yes.
And there's not
Yeah.
there's no shame in it,
Yeah.
but I'm hoping that when someone goes and gets help, there's help with helping their children at the same time. I know child
Absolutely.
psychologists help
Yeah.
parents. Do adult psychologists help parents parent too? I don't know.
Absolutely. I think it has to do with the level of expertise of the therapist. Some therapists work solely with adults, some therapists work with kids and parents. Most child therapists that I know work with parents as well because that comes as a part of the package in terms of it depends on what your goals are, right? In terms of individual therapy, if they're just going into their own trauma, their own childhood trauma maybe and how it impacted them going forward, that might be more of an individual therapist. So it's really all about your goals. Are you working on co-parenting? Are you working on the trauma of the divorce and getting past that? So there's a lot of facets to this and it depends on what your goals are, but absolutely there are therapists that can help with any of this. And therapy, by the way, is not the only, like individual therapy is not the only method of support. Parents, there are support groups for women and men who are going through divorce. Also finding a community of friends, community of women or men that are getting together and supporting each other and self-care also making sure that as you said you're putting the oxygen mask on yourself first and taking care of yourself so that you could then take care of
I
others.
love everything you said. And I just feel like I keep needing to say, give grace to yourself because you're going through something hard. And I feel like we're putting so much pressure to be the perfect parent.
Yes.
It's crazy.
Yes.
It's really crazy. And it's just not fair. So say it's okay. Like you said, self-care, support groups if it helps, individual
Yeah.
counseling, and there's family therapy too. Would family therapy be the appropriate place where
Absolutely.
you'd put all the pieces together?
Absolutely. And again, look, every case is different. Sometimes there are parents that can't even be in the same room as each other, and it's actually toxic for the
I
child to
see.
be in that room
Oh,
because they're seeing their parents fighting so much and that's not a good idea. But there are other cases where it is a good idea. I actually just recently had a case where I was working with a parent and she was having an issue with her child and I said, "You know what? Maybe we should bring in your daughter and talk together." So therapy doesn't always have to be named like this is family therapy. This is individual. It's, how the way I work is let's bring in your daughter. Let's have it. Maybe we can communicate this together. So the needs change organically as time goes on, as people get more psychologically healthy, and having a conversation with someone is a healthy
I love
thing
that.
with your loved one, right? So yeah, so I think it doesn't have to be like I need
Right.
family therapy or I need couples therapy or whatever it is. It could just organically
Right, and
come.
if the parents can't be in the same room,
Yeah.
you could have mother with child, father with child separately,
Yes.
right?
Absolutely. So that's why I'm saying there's no one formula that's the correct formula. It really depends on the case and the situation. Because, on the one hand, like I said before, it could be very toxic to have two people arguing and at each other in front of young children. And then on the other hand, it could be very healthy if two parents are in a good place emotionally and are able to say, you know what, it's not your fault. We're both here for you. We love you. This hasn't changed our relationship with you at all. And expressing that in front of the child is very healthy. And even if the child is seeing their parents able to communicate with each other effectively, even if they're not together. So it gives the message to the child like, okay, these changes are happening. We're not going to be they're not going to be living in the same house anymore, but we still can talk to each other. We still can communicate. They're cordial with each other. It's modeling, right? You're modeling for your child. I can talk to someone respectfully, even if I don't agree with them.
We're not really talking about all the other pieces that come in a setting of divorce, which is there are so many issues of substance abuse, infidelity,
Yes.
gambling. I could go on and on with the list, and then you no longer
Yes.
have potentially two parents who can function well enough to do this.
Absolutely. And that's why I'm saying it's a case
Right.
by case basis, because there are cases where, like you said, there are all of these stressors, and we can't have that. We can't have the whole family in the room. It's just not a possibility. And that's okay. We deal with what we have and what we can do. And it's a step by step type of situation. Sometimes in therapy, I don't even have the access or communication with one parent or another, because they have such serious mental health issues, or they're refusing to communicate or be part of the therapy process. That happens a lot. Is it ideal? No, but it's the situation. So we have to work with what we have.
We have to work with what we have, and that's really important. And so I want to get to what was the other piece of what I was thinking about when I was talking about parents dealing. One was them dealing with their own struggles, their own emotion, their own stresses. And the
Yeah.
other is dealing with their child's emotions. And we
Right.
need to
Right.
talk about that. How many parents are there
Yes.
who are just crushed by the idea of hurting their child with all of this?
Yeah.
So,
Yeah.
how do we help
Yeah.
them?
Yeah. So we want to make sure that we let kids know that their feelings are allowed, like even the messy feelings, and they have the ability to express what they want to express. And the parent is not going to yell at them or put them down or react in such a horrible way to make it like the child hurt them so badly. Reflecting with the child, I see that you're feeling so angry and sad about this. That makes sense. It makes sense that your world has changed and this is a really hard time. So just validating your child's feelings is really helpful and allows them to feel safe to express themselves. And that is a simple thing to realize, like, just recognizing your child's feelings and calling it out and saying, that's okay. I understand. We talked a little bit before about predictability and routine, keeping their routines as predictable as possible. For some kids, and I know you said you wanted to get into neurodivergence, and using this is especially important with kids that are neurodivergent, but using schedules, visuals, helping them understand what the schedule is. So it's not every day like, what am I doing? Where am I going? Which bed am I going to be sleeping in tonight? And as adults, sometimes we forget, oh, who cares? We'll sleep here, we'll sleep here. For kids, it's really important. And very often, this is what they're thinking about all day. What's today? What am I doing? So the most, the more that we can help kids understand what's happening and the predictability, the less anxiety they're really going to feel. So I can't emphasize that enough. Another thing that I would recommend is building a narrative. You need to make meaning of what's happening. Very often they're experiencing things, and especially if they're young, they don't know what's happening, right? They're giving their own interpretation about what's happening, but they don't really know. They see, oh, mom is really mad at dad. What's going to happen? Is she going to leave forever? Am I going to see her again? So kids develop their own interpretations. So helping kids develop their own narrative. This is a grown up problem. This is not your fault. You didn't cause this. Both of us love you. We're always going to be your parents. We're always going to be there for you. We're going to make sure that you're safe. And developing these narratives are so important for the nervous system for kids to just help them feel like, okay. I'm safe. Because when divorce happens, right, just blows up their world and they start feeling the trauma at times from that.
Right, that's great. I'm still thinking about the parent who's trying to talk to the child and hearing I should be helping them with their feelings and helping. What if they can't?
Yeah. So that's really important. Look, nobody's perfect. We all have our emotions, right? Modeling appropriate coping strategies is so important. So let's say, like, I'm feeling really angry about something. It's okay to say, I'm really angry about this. And I think I need a little time to cool down. And I'm going to take some deep breaths. I'm going to listen to some calm music, and then I'm going to come back and talk, because right now I'm just too angry to have this conversation. It's really showing kids like, oh, okay, we can have our emotions. That's okay. And this is how we deal with them in an appropriate way. Um, Even if we act in a way that's not the best, right? We yell at our kid or we slam the door or something like that. And then afterwards we go, oh gosh, what did I do? We can go back to our kid with a calm moment. Ugh, you know what? I really didn't deal with that in the right way. I'm sorry. I really didn't mean to raise my voice like that. And you're modeling repair. You're modeling that you can make a mistake and you can connect. You could reconnect. So just modeling the best coping skills and being the best person you could be with all the mistakes and everything, I think is really important for parents
I
to
love that,
remember.
and I did a separate interview of a psychologist on quote unquote gentle parenting, which is getting so maligned right now. That's a whole separate
Yeah.
topic, but we talked a lot about this
Yeah.
concept of repair, and we talked a little bit about the good enough parent. There is this idea of the perfect parent that is being
Yeah.
circulated around, this
Yeah.
Instagram perfect parent, and it's so
Yes.
toxic. Make it stop,
Yes.
right?
Yeah.
Without even this extra
It's so
and you're doing an
yes, yes.
amazing thing when you come back to your kid and say, I shouldn't have done that, because they lose their temper. And okay, mommy did
Yeah.
too. And I'm sorry, and I'm going to try
Yeah.
better. But there's still the
Yeah.
tricky piece of not oversharing.
Yes, yes, absolutely. And I'm thinking of it even in the context of divorce because emotions are so high with many interactions involving that. So that's when parents are lashing out at times or having difficulty. So, absolutely, just being able to go back and say it's okay and modeling that is super important.
Not your child is not your therapist.
Right, right. Giving too much information and then also the developmental
Right.
level. You have to think about how much if you have a 5-year-old, what do they need to know? They need to know where they're going to be. They need to have that safe understanding. Safety is the utmost importance for any age child, right? We want to make sure that they feel loved and they feel safe. And that comes with predictability and routines. That comes with our narratives, right? No matter what, we're going to be here for you. We love you. It's not your fault. This is a grown up problem. Kind of reiterating that for young kids. However, with teenagers and preteens, they know what's going on sometimes. Sometimes they know more than we think they know, right? Even if we want to protect them from that information. So it's important to tell the truth in the best way possible without oversharing. It's not easy. It's a very nuanced thing, but we don't want to undershare either because and I've seen this many times where parents try to hide what's happening and they push it under the rug because they don't want their kids to worry about that. And if you have savvy preteens or teenagers, they're already making up what they think is happening in their head. And very often it's worse than what is actually happening. So, providing them with age appropriate information is important so they can wrap their head around it and understand it in a comprehensive, safe way without having to know every single detail.
I love that. And I just want to underscore the concept of developmental readiness. Different kids are at different developmental stages. It's not just by age.
Yeah,
And
right.
I'm guessing that you can also take a minute or two to ask your kid, what do you know? What do you think? So you see where they're holding.
Yeah. Yeah, that's a great point. Absolutely. Letting them lead the conversation is also a great tool. And just steadiness, like being there for your kid, being around them, allowing them to feel that, that you're there. You don't have to ask a million questions. You can just provide that space for them to feel safe and ask you whatever they want to ask you. And then providing a response, an appropriate response. And it's tricky sometimes what an appropriate response is. But yeah, you want them to trust that you're telling them the truth and yeah, I would just say truth because that's important. Because if they think you're lying to them or you're hiding things from them, it really develops into a deeper issue of trust. And then other things that you say, they might not believe you. They might be take it as, oh, there's more to this that I don't know. And they develop this not fully trusting relationship. And again, it's the parent is usually well-meaning, right? It's not that they want to do this, but maybe they don't know how much they can share. In general, I think like hiding is just not a pretending and hiding. So we have to differentiate between pretending and hiding from giving them age appropriate information and therefore not being your therapist, them being your therapist kind of thing.
I love that you keep emphasizing this because it is so important. I still remember when I was very little and I was like 6 or 7 and I had a friend my same age, he was dying of leukemia. And I remember every interaction like it was yesterday. I remember my mother on the phone. I remember trying to get her 3-year-old brother
Yeah.
to tell us what was going on because no one else was telling us.
Yeah.
And it was truly terrifying. It wasn't like the reality. Unfortunately, he passed away. Now we can save kids with leukemia,
Right.
but not then. But kids need to know it's always better to tell them in a developmentally appropriate way.
Yeah.
I also want to say that if you don't know, you can ask a professional. You might not know.
Absolutely. And you could say, I don't know to your
Right,
kids also.
right.
I think it seems obvious, but a lot of parents feel like they want to be they have to know everything. You know, you could say, I don't know the answer to that. And I know it's really hard to not know, especially after parents get separated, like within that next few weeks or months. There's a lot that has to happen, like a process with attorneys and mediation, and where many times they don't know it's mom, what's going to happen? I don't know what's going to happen, but this is what I do know. So I know that you're loved by both of us. I know that you're going to be safe. I know that we're going to provide for you. I know that you are always going to be our first priority. But don't know exactly what our routine is going to be, but we are going to develop a routine and then you're going to get used to it. So, really understanding that uncertainty is super difficult, even for adults, to not know. And again, you're modeling how do I deal with that uncomfortable feeling of uncertainty?
You can say it's hard to not know, but we're going to continue to talk and you can ask
Sure.
me. You can ask me anything and I will tell you to the best of my ability.
But instead, sometimes parents make up something because they don't want to say, I don't know. So they'll make up an answer, and that's difficult because then it's, but you said that this was going to happen and then it didn't happen.
Right.
It's much better to say, I don't know, than to give an answer. You
I'm
don't
laughing because I have a tangential story from a reel I saw on Instagram. I'm just going to tell this story because
know.
this little girl asked her parents who were atheist, I have a Jewish friend and a Christian friend. What religion am I? And the father couldn't say we're atheist. He just couldn't say it. And so he said, we're goth.
Oh my God.
She took it so
That's funny.
seriously. And she finally met someone super goth on a subway. And she goes, why do I not look like you? And she goes, you're secular goth and I'm ortho goth.
It's funny.
But
It's
it's a cute
funny.
story. But this child took what she was told in that moment like it was from God giving it from the mountain.
Kids listen, they hang on to that information. And that's why it's important to say, I don't know
Right.
when you don't know. And it's like, also, oh, my mom doesn't have every single answer. Sometimes she
It's
doesn't know,
okay.
right? And that's okay. And then that leads me also to the next step, which is resilience through trauma. So these negative situations that happen at the time are obviously very difficult for all the reasons that we talked about. But kids, and I'm sure that you can think about a time that was terrible for you. And then later, much later, oh, okay, from that experience, I learned how to be more flexible. I learned how to communicate better. So had that not happened in my life, these other good things that made me stronger might not have happened. So looking at it in terms of that, because a lot of times parents are like, oh, they blame themselves, right? And they say, I'm doing this to my child. I'm ruining their life. Everyone's going to go through something in their life. And it's just about how we cope with it. So it's teaching them, okay, this is very hard. How are we going to grow from this experience?
Absolutely. Beautifully said. And I think that, and I said this in other episodes, that one of the hardest, worst pains is you're experiencing your child's pain. They said it hurts me more than it hurts
Oh,
you. It
yeah.
does.
Yes. It's very hard, of course, to see your kids. And that's what I think sometimes makes us do the thing that's not really the healthiest. Give them answers that we don't have, or force a situation just to make them happy, even though we don't really need to, like overcompensate, for example, because we love our kids so much and we want them to be happy. So it's something we have to watch out for so that we know how to navigate those feelings. Kids aren't the only ones with strong emotions, right? Parents do.
I think it's also okay to say in the moment a child asks you something, they hit you with a whopper and you're not ready to say, I'm not ready to answer that question, but I will get back to you when I am.
Yeah. Or, you know what? I really have to think
Right.
about that. I'm not really sure right now, but I'm going to think about that and I'm going to get back to you. Yeah.
It's about being honest, it's about being human. You're modeling that as well. No, we don't know
Yes.
everything, we can't know everything. We can get help from people who may know more than we do, and we may need some time to get ready to answer a question properly, even if it's to regulate our own emotions because that question hits so hard.
Absolutely. But then at the same time, like both, we might not know the answer and we want to make kids feel safe. Right. So it's not, oh my gosh, we don't know. What are we going to do? It's okay. We don't have this answer now, but we do know this, and this. And so then they have something to hold on to. And it's not just everything they once knew is now not true. Like we need to ground them and give them that foundation.
Right, and if you listen to their questions, they may want something very simple that you could not have anticipated if you can keep those lines of communication open.
Am I going to be able to bring my teddy bear from house to house? Like how easy?
I want to
Exactly.
just take a few minutes because I was so impressed by what you said about autistic slash neurodivergent kids. And I think this is
Yeah.
really relevant to all kids in different levels, but I'd love to hear
Yeah.
what you said about that.
Yeah, sure. So I think that a lot of the techniques that we use for neurodivergent kids are very similar to what we use for typical kids. I think that the routine and the predictability is extremely important, and we might want to use more tools to really illustrate that, whether it's visuals or calendars or timers or even cards. Like we have story cards that we can write on with, this is what happens at this time, this is what happens at this time, and it really helps them to understand and grasp what's happening in an ever changing environment. So that's one. And then, neurodivergent kids, a lot of times, and again, there's no one size fits all, right? Like they're all different, but sometimes they have difficulty communicating and it comes out in behavior, right? Instead of words. So we just really have to be aware of when behaviors occur, when there's agitation. Is it when they're going to their dad's house or when they're going to the mom's house, or is it when they're going to sleep at night, or is it around eating? So we have to make sure we are aware of those things and not label them as bad kids because they're acting out, but really trying to understand their behavior and what's behind it, because it's their way of communicating a lot of times, either something that they're not happy with or something that they're anxious about. So we want to make sure that we are observant and also provide them with whatever information they need and give them a way to communicate in a healthy way rather than an unhealthy way.
I love that. And we always have to remember that behavior is a form of communication. It's not a kid being bad,
Yeah. Yeah.
right?
Yeah. That's I think one of the most important things, because and we said before about it's the hardest job in the world to be a parent, right? You have kids who maybe are having temper tantrums and being oppositional and calling you names because they're not happy about the divorce or they're angry, right? As a human, right, you're dealing with your own emotions. And then on top of that, you're dealing with your child's behavior. And it at times could be disrespectful. So it goes back to regulating yourself, right? And understanding that they're a child and this is where they're coming from. And once you're regulated, you're able to think more clearly. Oh, okay, now I understand why he had a temper tantrum. And very often they don't have the skills that they need to communicate effectively or to cope with a difficult situation. So we have to understand that's the reason for the behavior and then provide them with those skills or teach them how to cope in a more acceptable or healthy way.
This is why God invented child therapists because I don't want the parents to think, oh, I have to do this on top of everything else. I can't.
Absolutely. And we're here to help, and that's what we do. And parents just have to also not be so hard on themselves and understand that they're human. It's okay to have feelings. We all do. And nobody's perfect. But if you have that, really, to me, what I like to to say that if you love your child, which most parents do, just to give them that love and that support, that's the best thing that you can do for your child is provide that love and support, that unconditional love, safety, and space to be themselves. And it's going to take them time. Understanding that not only is going to take you time, but it's going to take them time to adjust to a new situation. And they will.
I love that. And I could end on that note, but I'm thinking about something else.
Okay.
And what I'm thinking about is we talk about your village and it's like, what's the word, the stereotype, whatever. But I think
Yeah.
that if you find people, whether they're neighbors or other relatives, who can help you, I think that they can really be so important at these stressful times.
Oh, absolutely. That's incredibly important because it's self-care, right? And it's also care for the kids, of course, but the more support that you have as a parent, better, right? The less pressure you feel to just be that person. When you think of yourself as the parent, it's, oh my gosh, I'm in charge of the situation. But if you have other people that are around you that are helping, it's okay. I'm not the only one. It makes you feel like you have other people that are helping you and supporting you and that you can ask for help when you need it. You don't have to just tough it out every single time by yourself. It takes a lot of pressure off of a person, which of course then allows you to act more appropriately to your child in a healthy way.
Right. It's an escape valve for you, but it's also a supportive person for them that may be in a better place than you are, in all honesty, right?
Yes. Yes, absolutely. And that's hard to, right? Ooh, I'm not in a good place right now. They're better off over there because I'm just really angry at this moment, or I'm really sad, or I'm grieving, or whatever it is that you're feeling. To say, you know what, my child is better off for the afternoon at somebody else's place. That's a powerful thing to be able to say as a parent.
Especially if you
It's
have
brave.
grandparents that can help. I did a talk with a
Yes,
grandma physician on the power of grandparents. If you have them, they can be invaluable.
of course.
Invaluable.
Yes, absolutely.
So I want to
Absolutely.
thank you so much. This is so helpful, I think, for so many people. I really appreciate this.
Thank you. Thank you for having me. And it was a
Yes, it
pleasure.
was. Thank you.
Thank you for listening to Kids Matter. Raising healthy, happy children takes a village, and I'm grateful you're part of ours. If today's conversation resonated with you, please share this episode with another parent, grandparent, teacher, or anyone who cares about kids. Together, we can build the supportive community our children deserve. I'd love to hear from you. Share your thoughts, questions, or suggestions for future topics at kidsmatterpodcast@gmail.com with no exclamation point. Your voice truly matters. Until next time, keep advocating for the children in your life because kids really do matter. They are our future. I'm Dr. Elisa Minkin, and this has been Kids Matter. Please note that while I am a pediatrician, I am not your child's pediatrician. This podcast is for informational purposes only and does not constitute medical advice. For any medical concerns or decisions, please reach out to your child's healthcare professional.